The natural hormones, they're still hormones. Can these cause cancer? Has there been any studies done on natural hormone therapies?
There haven't been as many studies done on the natural bioidentical hormones. The studies that have been done have been clear. There's no increased risk of strokes, there's no increased risk of heart attacks, and there's no increased risk of breast cancer. And if you look at physiology and look at biochemistry, there's no reason to suspect that those things will increase the risk of strokes, heart attacks, and breast cancer.
Well, then I'm really confused. If this study's been out, the results are there, and you're telling me that everything that you've seen in practicing this for 17 years is these are the safer and more effective way to go. Why are they not the first line of defense? Why are they not the first thing that physicians go to when they detect a hormone insufficiency of any kind?
Well, unfortunately, physicians aren't taught about these things. They're taught about patentable synthetic foreign substances like the synthetic hormones, and they really don't have a lot of knowledge or experience using them. That's primarily why women haven't been able to utilize these things. But now with the internet, now with books being out there and articles being written, there are other options. And as I said before, there's no reason to use synthetic hormones for any condition.
Well, I'd like to talk about some of these other options because I guess it's pretty clear at this point that the synthetics are not the way to go. So let's talk a little bit more specifically about these hormones. And let's start with progesterone because I know progesterone is it's very well known. You can go into the health food store, you see tons of it in there. Talk about some of the things that a woman might feel if her progesterone is deficient, and some of the things that progesterone or natural progesterone cream may help, because as we've learned from the study and the other things that you've said, progesterone cream in the form of synthetic progesterone, the Progest, is not the way to go. So talk to us a little bit about natural hormone therapy in terms of progesterone.
So progesterone is produced in women in their ovaries, and it's produced in men and women in their adrenal glands. And progesterone has some anti-cancer effects to it. It has some anti-diabetic effects to it. It has properties to prevent strokes and heart attacks and blood clotting. None of those factors apply to Provera, the synthetic form of progesterone that's being used by conventional medicine. And progesterone is easily prescribed as a pill or a cream. It's available at health food stores. It should be the most common progesterone prescribed in the United States. Unfortunately, it isn't, as most doctors still prescribe the toxic synthetic form, Provera, that has been shown to cause invasive breast cancer, heart attacks, strokes, and many other serious illnesses.